Thank you so much. So I'm Mike Dunn. I'm the Executive Vice President, Rogers and Cowan PMK. We are an integrated marketing agency who provide brand solutions across entertainment. I run a group that is very focused on music and esports. I'm lucky enough to work on Northwell Health, which is a client of ours. We have been successful in building a purpose-driven platform around military and supporting veterans and their families, and also supporting healthcare workers because of obviously the pandemic and everything that's transpired over the last year and a half or so. I'll let Ramon introduce himself because he's going to do a better job than I will, and then we can get into the topic of the conversation.
Thanks, Mike. So my name is Ramon Soto. I'm the Senior Vice President, Chief Marketing and Communications Officer for Northwell Health, a long title. I've been here for about 6 years, and my job was really to transport marketing in healthcare to a very different place. If you think about how healthcare organizations typically market, we market in terms of what we call an episode of care. A person gets injured, they get ill. They see this great institution, they see this fabulous clinician, they get better. But the opportunity is really to redefine that and take the journey with the consumer very differently. Requires us to be purpose-driven, to really focus on the mission of healthcare, to have a dialogue and conversation, to engage with consumers very differently than we have in the past, and to tell the story very differently. So we'll share a little bit of that journey with you today. Mike has been a great partner in helping us engage very differently with consumers.
Great. Yeah, so let's talk about that. Content being the key piece, right? I think we've all been inundated by so much content over the last year and a half or year. Live experiences have become content, virtual concerts, everything is content. But I think the real key is how you truly stand out. And is it amongst your competitors or is it amongst everyone, right? And I think we've really seen brands step up and understand the value of purpose and saying important things and having great values. Northwell, I don't know if everybody's super familiar with Northwell Health, but they are the largest employer in New York. They oversee hospitals like Lenox Hill and some of the biggest hospitals in New York, and just an incredible company driven by purpose. Ramon has done such a nice job diversifying the company from all the sponsorship assets that they're a part of, and really just a great storyteller. I mean, Ramon is a true marketer. He understands his audience so well, and what's going to engage them in a big way and really build community. So I'd say Northwell had maybe not exciting, maybe an eventful year, right? Administering the first ever COVID vaccine to Sandra Lindsay, which was a big moment for the brand, and just being there on the front lines of COVID. So really a unique position for a healthcare company. And so I'd love to hear a little bit from Ramon on, how that thrusting into COVID changed or inspired the way you approached your content plans and your strategy and how you went about it.
So thanks for the question, Mike. COVID was a shock to the system, a shock to society, one of those cultural moments that hopefully we don't see for a very long period of time resurging. And it was very important for us to take the journey with consumers. We were the front line, and as Mike talked about, Northwell is the largest private employer in the state of New York, about 75,000 employees. We run 23 hospitals. We have about 850 physician practices, ports of entry, if you will, for consumers. And we have about 30% market share in New York City. And when COVID hit that first wave, New York was the epicenter of COVID in the country, and Northwell was the epicenter of COVID in New York. It really puts in perspective the mission. I will tell you, they were pretty dark days in the early days. We took the playbook and we actually threw it out, and we were inspired by the epidemiology of the disease. And COVID looks like a bell curve. And that first front end was all about making sure that we were taking the journey with consumers, that we were flooding the zone with information, that we were addressing the fear that this stealth-like disease permeating through society was creating, because we knew we would get through it. And we had been through different issues in varying degrees like this before. At the peak of COVID, that first wave, the message shifted to resilience and recovery, and that we had successfully gone through it, and that we wanted to celebrate this cultural moment where you had the 7 p.m. clap out and a society that was very grateful to those who ran towards the danger. And then post that resilience phase was the recovery phase, because many consumers put aside their own personal health because they didn't want to touch the disease. But that had a number of knock-on effects, and we had to get people back into our institutions. Now we're in this COVID tail. It's COVID in a chronic state. It's not going away. So how does society deal with that on a long-term basis? And Mike really helped us at the peak celebrate healthcare heroes who ran towards danger to keep us safe. And historically, we would do brand acts to engage with society and the public and make sure they knew who we are and what we believe from a mission standpoint. Northwell stands for Better Health for All. It's a very democratic view, a populist view of healthcare in the best use of that word. And we had executed a number of engagements focusing on different aspects of healthcare delivery. One, which is near and dear to our heart, is military and veterans. And we had done really the pinnacle event, the closing event for Fleet Week in partnership with the Navy back in 2019 as a grand event. It was daytime activation, a takeover of Rockefeller Center, an evening concert with Imagine Dragons headlining, a lot of public interaction. During COVID, we had to throw out that playbook as well, and it turned into a celebration of all those who ran towards danger to keep us safe. So still recognizing active duty military, still recognizing the veterans who have served this country so well, but also a reflection of frontline nurses and nursing staff who did extraordinary work in an extraordinary period of time. And the results were very positive. And Mike, I'll pause there.
Yeah, look, I think that that's great, right? I think as a healthcare network, you inherently have these amazing stories built in, right? You have real heroes working for the company that are doing just amazing work in the community and just overall. So taking those stories and putting those out as content and allowing people to engage with it, I think is really powerful. And what I love about what Northwell does is you wouldn't expect a healthcare network to show up in these great, passion points, right? They really understand their audience. So whether you're at an Islander playoff game, you may notice Northwell, they're naming rights at Jones Beach. They're just really there at the point of passion of their consumers. And I think it really gives them a benefit over all the other hospital networks, right? Because they really understand what drives behavior. And it's not about just, constantly talking to people when they're not feeling well, but it's this feeling of community. And I think Ramon in particular has done such a nice job coming into Northwell and leading this charge and really leading with purpose, which again, I think is used very frequently now, but they really are a network that leads with that. And I think it starts with Ramon and all the way up to Michael Dowling, who's the CEO. So yeah, look, I think we're telling some great stories. And, I think content's a great way to do it. We've seen it evolve. And, like Ramon was saying, this year we did a little bit of a hybrid of in-person events and content as well. And I think it was a nice mix. I think we're both very excited to get back to live. But obviously content's going to be a big part of that, right? You need to have something scalable that's going to help tell your story to as many consumers as possible. So Ramon, I guess, talk to me a little bit about some of the other efforts that you guys are doing. I know that we featured, the nurse choir, the Northwell Nurse Choir, which has become quite the big deal. I don't know if folks watch America's Got Talent, but the golden buzzer winning Northwell Nurse Choir has really taken on some heat, and everybody seems to love them. They have such an incredible story. Why don't you tell us a bit about that?
Sure.
How
So
that came
Mike,
about?
this goes back to your comments about content strategy and engagement. So just clicking up a level, what we try to do in terms of taking the journey with consumers differently and engaging with them, not just shouting our brand to them on the paid side, but really having these intimate moments, these purpose-driven moments. We look for these very special intersections of culture and health, these moments of opportunity to help illuminate the brand, and certainly help. If you look at these very special moments in time, and you can shine a light on the brand very differently, it allows you an opportunity to tell a very different story and take a journey with consumers differently, and then also gives them an opportunity to absorb your brand in a very special way. Arguably, this started with Side by Side, the program that you helped us launch. We also did a 9-episode Netflix docudrama called Lenox Hill. Very positively received globally, over 12 billion impressions. Didn't cost a lot, traded IP value to Netflix for really distribution access for the content, but storytelling and content creation at its core. We will be releasing a COVID documentary in partnership with National Geographic's later this year, because it's this important cultural moment that deserves its place in history and an understanding of what happened behind the closed doors. You know, these nurses again, and these physicians who ran towards danger. For the last year, you've only seen them in masks. And what are their loves, lives, passions? Who are they? How do they deal with this? What was the real mortality that you never saw in arguably a war that we went through? And then again, these moments to celebrate these people who have protected us. It was interesting. We did a streaming concert last year for Nurse Heroes in November. And we curated about 50 nurses across Northwell who could sing. We did the whole singing boxes, kind of like Mike and I are talking here. They did a smash up song of Stand By Me with Leslie Odom Jr. Fabulous content. It got picked up by America's Got Talent and said, look, this is this really interesting moment where we have an opportunity to celebrate those who have kept us safe, and again, add texture, content, a persona around these individuals. So 18 of those original 50 nurses, because of COVID restrictions, were invited to compete on America's Got Talent. They performed live, and as Mike suggested, they got the golden buzzer. The NBC did a great job with content creation around their whole life story. It was incredibly powerful because they were brand ambassadors, not just for Northwell, but for a whole cadre of people who have protected us. You know, nurses across the country were very proud, and we were proud to just allow them to move forward and tell their story. Very positive reaction. Howie Mandel hit the golden buzzer. I don't really watch America's Got Talent, but it was fascinating to watch. I cried. They advanced to the next round. They're legitimate contestants for $1 million. And it's a brand act. It is another moment where we're building brand love, this engagement point with consumers, so that we're not fighting when they're going through a health event to create this relationship. The relationship is starting well before that. We're filling them with knowledge of who we are, our ethos, the kind of brand that we are.
Yeah, look, I think that's super important, and I think that's why it's been successful, right? I think something that you just said that really rings true is, I think with a lot of other brands I work with, a lot of time the marketers want the brand first, right? They want the brand up front. They want the brand getting all the first credit and kind of that first look. With Northwell, they lead with the story, right? And I think that's what helps make this emotional connection and has people leaning in, right? Because they're so compelling that when you start to hear it, you want to know more. And then you start to discover that it's Northwell behind it, or Northwell is the one that creating all this amazing work. And I think that's why it's working, right? I think leading with story versus brand, and allowing, you mentioned some of these artists and different platforms that you partner with, allowing those partners to pull your brand in an authentic way, right? And giving it a real purpose, which doesn't always happen, right? I think sometimes brands, it's like they have a logo placement. That's not what Northwell's about, right? They want to lead with story and true engagement. And I think they're smart enough that they know the brand is going to follow and help build that brand awareness in a really positive way.
To build on that, Mike, so we're very comfortable being in a supporting role. So for America's Got Talent, the nurses were the heroes there. For Side by Side, active duty military and veterans are the hero there, and we're in the supporting role. If you look at the metrics, it builds brand love. I am telling you right now, the Side by Side, the first year that we executed it, we studied the marketplace. We had a 66% increase in brand stature. To date, our net promoter score has never been higher. Awareness levels have never been higher. Likelihood to recommend, perception of the organization. Part of that is this cultural moment that we all went through. We all have gratitude for what health systems and healthcare did. The other part is how we curated the brand through that moment and really provided content to New Yorkers, taking the journey with them, making them feel safe, making them understand that we were going to get them through this in a very successful fashion. That has pretty substantial dividends. For us now, the challenge is how do you lock that in? And how do you lock that in an environment where nobody wants to talk about COVID anymore? We certainly don't want to talk about COVID anymore. So we're evolving to that next stage of relationship building, content generation, and engagement with our consumers.
That's great. So we know Northwell services are offered in New York, but the brand itself has more of this national feel and scale, right? Sandra Lindsay was on the inauguration, right? And she was the first nurse, a Northwell nurse, to get the vaccine. Talk to me just a little bit about that, right? I mean, I think really focused on New York, creating content for that community, but then kind of it's bigger than that, and the stories are bigger than that, right? And so, talk to me a little bit about being so focused in New York, but how that really grows outside of that into a national presence.
Yes. So first of all, great question. Our core market is in New York, and we do tailor that content for that marketplace. The secondary KPI is to build national presence. We want to be a destination healthcare brand across the country. And very purposely, we use earned media to do that. I think Sandra Lindsay was a great example of that, where she was the first person in the United States to receive her vaccine. Everything that happened that day when she received her shot was curated, highly choreographed, orchestrated to make sure we were building that national and frankly international presence. And that too has paid off in dividends. And I see Emily, our friend, is back. Emily.
I don't mean to cut you off early, but
all good.
Great story to end on. I feel like that was, obviously a huge, brand awareness moment, and just a great moment for the country overall to get to witness and celebrate as a community. So thank you so much for joining our program today, both of you. Thanks, Michael, for being a great moderator, and we hope to have you both back again soon.
Sounds good. Emily, thank you. Mike, as always, thank you.
Have a good one.
You too.
Great, thanks. Bye now.
Bye. Well, we are excited to move into our last panel of the day. The program has just flown by with so much, great content material shared by so many great marketers. And this last one is no exception. So we're really thrilled to be hearing from Eduardo Luz, the Chief Brand and Concept Officer at Panera Bread.